Hello everyone, I am presenting on the effects of prolonged bed rest on the pulmonary system. Here is my summary slide of all the things I'll be covering in this presentation. We're going to talk about the primary effects of bed rest, how it will present during illness and during recovery, and the implications it'll have for us as PTs and the precautions and kind of how to keep our patients safe. Okay, so the primary effects of immobility on the lungs. If someone has had an accident or has a certain pathology that leaves them bedridden or in the hospital for a couple of days, this will clearly have a negative effect on the pulmonary system and then make healing from that accident or pathology all the more difficult. If someone is supine for prolonged periods of time, this is obviously going to cause decreased strength of the respiratory muscles and lead to diminished lung expansion and decreased oxygenation. Also, this decrease in strength of the respiratory muscles will cause less productive cough mechanisms, which would lead to secretion pooling. If there is pooling or a collection of fluid in the lungs, this puts the patient at risk for developing infection or could also cause lung collapse. Also, since we're seeing a decrease in ventilation, this is going to impair gas exchange, and we're going to see a low ventilation perfusion mismatch, which would cause decreased oxygenation in the tissues. Also, prolonged periods of inactivity puts the patient at risk of developing blood clots, which could obviously then travel to the lungs and cause a pulmonary embolism. So, how will this patient present in therapy? When you go in to see them, you might notice weak breathing patterns. The patient might seem short of breath or have shallow breathing. You might also notice excessive dyspnea upon exertion when you ask your patient to sit up or evaluate their range of motion and strength. This decrease in oxygenation is going to cause excessive fatigue in your patient as well, so you should be aware of that. Also, if you were to then auscultate the patient, you would notice diminished lung sounds and you might hear some crackles. This could be due to impaired airway clearance from fluid retention, etc. How these effects will then affect the patient during their illness and during their recovery. During illness, you might see again excessive fatigue and confusion due to decreased oxygenation. Also, if there is decreased oxygen in the blood and in the tissues, this is going to impair healing. So during recovery, when we start working with the patient, their lack of lung expansion is really going to impact their ability to participate in rehab. So you might need to give them a lot more breaks, and they might have a really difficult time doing what you are asking them to do. Also, long term, you might see a persistent reduction in endurance and exercise tolerance. So this is going to be something you'll have to work on with the patient even after they're no longer recovering specifically from their illness. Treatments to focus on in therapy. So obviously the first thing we're always going to do with our patients is educate them about what's going on. They need to know that this prolonged period of immobility is having negative effects on their pulmonary system. So how we're going to address that in therapy is we're going to teach them breathing exercises. We can start with diaphragmatic breathing, pursed lip breathing. Pursed lip breathing is especially important in alleviating dyspnea and increasing their tolerance to exercise. We'll also want to do segmental breathing for certain parts of the lung that we really want to prevent accumulation of secretions or reduce the probability of atelectasis. We're also going to want to do stacked breathing due to weakness and help increase their inspiratory volume. We're also going to want to do some airway clearance techniques. We can teach them postural drainage. We can do manual techniques like percussion, vibration, shaking. It'll be really important to teach them how to enhance their cough, specifically with patients that we're seeing really weak respiratory muscles. We want to teach them either self-assisted techniques to enhance their cough or show them how a caregiver can help enhance their cough as well. We also might have to use airway clearance devices if we are seeing too much pooling or, blockage of airways. We are also going to when we start doing movement, we're going to want to pair ventilatory strategies with exercises. So, while we have the patient exercising, we want to pair certain movements with inspiration and expiration to decrease the work of breathing and increase their tolerance to exercise. We can also do some thoracic mobilization to expand their lungs and pair this with deep breathing so they can learn how to do this on their own. Alright, so some things we're going to look out for during treatment. Precautions are obviously going to revolve around what the patient is being seen for, why they're on bed rest. So a lot of these techniques might need to be adjusted depending on what they're being seen for. For example, with incision sites, with enhancing cough mechanisms, we're going to want to protect that site. We're going to teach them to cough down towards that side rather than away from and avoid stretching of the incision. Also, we are going to progress activity gradually. This patient is clearly going to have decreased endurance, so we want to avoid overexerting them. We also want to continuously monitor their vital signs, and we also want to know the contraindications for postural drainage and the application of manual force. For postural drainage, we need to be really careful of, neurological issues, high intracranial pressure, head or neck injuries, any type of recent head surgery. We also want to be careful of cardiovascular issues as well, such as, hemodynamic instability, unstable angina. We also want to be careful with our application of manual force. So, for example, with patients with rib fractures or osteoporosis or chest trauma, we're obviously not going to apply manual force to their chest. And then things we are going to watch for. We really want to watch for respiratory distress. They might present with high, respiratory rates, or they might be cyanosed, and this would indicate that, they're not getting enough oxygen. And also for orthostatic hypotension, if they've been bedridden for long periods of time, it's really possible that they will not tolerate an upright position. So this would be a decrease of 20 millimeters of mercury in the systolic blood pressure or a drop of 10 millimeters of mercury in the diastolic blood pressure within the first 3 minutes of standing. And then most importantly, if the patient has sudden chest pain or, feelings of impending doom, that could indicate possible embolism, and this would be an emergency. One thing I learned from my research is really why pneumonia is such a common pathology, especially in the older adult population or in the hospital setting. Obviously, we know it is caused by bacteria or viruses, but obviously it can be caused from lack of movement. And now I understand that lying flat for a long period of time would prevent the lungs from fully inflating, and this obviously causes a buildup of pressure and fluid, and this is a perfect breeding ground for bacteria. And then the reduced muscle and immune function to clear the infection. So, I mean, again, physical activity just always shows me like how vital it is for every system in our body. If that has been the number one thing that I've learned from PT school, is physical activity is the best medicine. So, thank you so much. Here are my references.